Hi everyone, this is Bivash, and today we're gonna talk about a polypharmacy safety checker. So, as we age, our bodies process medication differently. Adults over 65 are often prescribed multiple drugs simultaneously for disease, diabetes, arthritis, anxiety, and more. This is called polypharmacy, and it affects 40% of older adults. The more drugs an elderly patient takes, the higher the risk of dangerous interactions, cognitive decline, falls, and hospitalization. Many of these events are entirely preventable. If someone catches the problem in time, we build the Polypharmacy Safety Checker, an MCP server that instantly screens an elderly patient's medication list against the AGS Beers Criteria, the gold standard safety guideline, specially written for adults 65 or older. It flags dangerous drug combinations, check kidney function thresholds, scores anticholinergic burden, the hidden driver of confusion and falls in older patients, and delivers a severity-ranked clinical report in under 2 seconds. It works three ways: plain text, FHIR bundle, or live EHR connection, deterministic, evidence-based, auditable. Well, in this case, let's start with a real scenario. An 83-year-old female patient with reduced kidney function, eGFR 32, is on five medications. I'll describe her to the AI in plain English. As you can see, I already typed the conditions and got the results based on that. The tool check patient safety was called. You know, it fires immediately, no manual setup, no form to fill. The scoring engine runs in the background. Well, risk score 10 out of 10 for this patient, very high. And you can see the critical concern sections, four critical concerns. Diphenhydramine is strongly anticholinergic drug, always avoided in elderly patients. Warfarin combined with ibuprofen dramatically increases bleeding risk. Furosemide combined with ibuprofen reduces the diuretic's effectiveness and strains the kidneys. And with an eGFR of 32, ibuprofen should not be prescribed at all. The anticholinergic burden, you can see that we also have the moderate concerns level. So let's focus on the anticholinergic burden at this moment, which is the burden score is 4, high risk for cognitive impairment and falls. And you can find the display here. The recommendations. The recommendation: immediate pharmacist review before the next prescription renewal. Okay, that was scene number one. Now let's go case number two. Now, you know, let's go one step further. In real clinical settings, patient data counts as FHIR and the standard healthcare data format. I'll paste a FHIR bundle directly into the chat. You can see that I already did this for the time constraint. I already pasted the case in JSON FHIR format, bundle format. And the tool actually fires immediately. Again, the bundle includes a structure condition resource. Uh, in this case, the input, heart failure. Now see what happens. Well, a new critical flag fires. Ibuprofen is contraindicated in heart failure. This is beer stable 2 disease drug interaction. It only fires because the tool resolved the ICD-10 code from the FHIR condition resource. The incomplete review warning is gone. All data was present and checked. You can see that previous result contains incomplete review, which is gone in the second answer. So yeah, here's the answer for second case. And now let's go with the case number three, the low risk patient. Well, Here I am inputting the case, and you can see that I got the result. So this is the low risk patient, and the tool also knows when things are fine. A 68-year-old on lisinopril and atorvastatin with normal kidney function. Score 0. No flags. Routine monitoring recommended. The tool doesn't cry wolf. And the polypharmacy safety checker is actually published on the prompt opinion marketplace and ready to add to any PO workspace with one click. So under the hood, it actually runs on Google Cloud Run, always on, zero cold start for scoring engine. The server exposes three MCP tools. Check patient safety for plain text, check bundle safety for FHIR bundles, and check FHIR patient safety for live EHR connections. I'll put the details in the description field. And here's the polypharmacy safety checker, catching dangerous drug combinations before they reach the patient. Thank you.